Hi, my name is Bruna Katz, and I'll be speaking about substance use in older adults today. I chose this topic because our older population is growing rapidly, and I believe it's important to dedicate research to this population in order to help their quality of life increase as much as possible. In this presentation, I'll be focusing on the growth of substance abuse among older adults in recent years, why substance abuse is especially dangerous to older adults, what leads many older adults to using drugs and alcohol, and the changes we need to make to our current treatment options in order to reach and benefit older adults. The number of adults age 50 or older with substance use disorder is projected to double from 2.8 million in 2006 to 5.7 million in 2020. And this increase is found among all genders, races, and ethnicities in the older adult age group. This is partially due to the growing population size of older adults and the high substance use of the baby boomer generation, as well as the growing availability of prescription drugs. But why is substance abuse so dangerous for older adults? Well, further problems arise when older adults use drugs and alcohol because they are impacted differently than younger ones. Older adults are at particular risk for negative health outcomes from substance use disorder, including falls, hypertension, cancer, early onset dementia, and cognitive deficits. The elder also have increased sensitivities to substances, which makes them feel the psychoactive effects while consuming lower quantities of the substance, since their tolerance is also diminished. This means that it is much easier for older adults to become intoxicated or even overdose. Therefore, it is crucial that healthcare providers, social workers, and mental health professionals be aware of the warning signs and potential risks in order to aid patients with resources. Helping professionals must be informed of these risks and be aware of how crucial it is to pass this information to those that they are helping. But why are more older adults experiencing substance use disorder? Research has found that older adults experiencing emotional and social problems such as grief, loneliness, and isolation, or medical problems such as chronic pain, insomnia, dementia, depression, or anxiety, are at greater risk for substance use. And in our world that is full of isolation and with our older population living longer and longer, it can lead to many of these medical problems. Therefore, it's very important to address these problems with the population before they turn to drugs and alcohol for relief. If we are able to provide older adults at risk of substance use disorder with psychological help, social programs, financial assistance, and free medical care, it could alleviate some of these struggles that the older population is facing and therefore relieve some of the symptoms that could lead them to seek out substances. However, when we are unable to prevent substance use disorder, we must have available and appropriate treatment. Most rehabilitation facilities do not have programs aimed at older adults. I believe adding programs that can better serve older adults would increase the likelihood of success when older adults must enter these programs. I believe we can cater to older adults by providing peers of their same age group, therefore creating a more welcoming social environment in which they could thrive, and providing age-appropriate activities. Before conducting this research, I did not understand the depth of this problem. Along with many others, I believe that substance abuse was more of a concern with teens and young adults, without understanding how much of a problem substance abuse really is becoming in the older adult population, and the risk that it carries. Therefore, I believe that it is crucial for the research to continue. If we do not have the knowledge of how much this problem is growing, why it's growing so rapidly, and how it's affecting our society, we cannot aid the older population with their substance abuse problems. The more we understand this phenomenon, the better we can help to prevent further substance abuse and help treat substance abuse disorder in older adults.